Symptoms and measures for the reduction or increase in blood sugar. Diabetes, which is currently a worldwide outbreak, causes other life-threatening diseases. It is very common for victims of this disease to complain of an increase or decrease in blood sugar. What should I do? And how should one estimate if sugar has suddenly increased or decreased drastically? In fact, it is difficult for many people with diabetes for years or decades to tell, but there are some symptoms that you can estimate to a great extent that blood sugar has decreased or increased and what to do in these situations. Want it? Symptoms of low blood sugar. This is when the blood sugar-insulin balance deteriorates, and the following are the symptoms. Feeling weak and shaky, sudden increase in heart rate, irritability, confusion and bad behavior, loss or loss of consciousness of the patient, skin yellowing and feeling sticky with frost. If a diabetic suffers from low blood sugar and his condition worsens even after giving sugar, he should be taken to the hospital immediately. A person who has recently been diagnosed with diabetes is more likely to have a sudden drop in blood sugar levels. Quick actions: give sugar. If the patient is fully conscious and alert, give him a sweet beverage such as fruit juice or any glucose tablets. Diabetes sufferers often have a glucose dose or something sweet, which doctors also recommend. Let the patient sit. If the patient is feeling unwell or dizzy, help him or her sit on a chair or floor. Check the reaction. If the patient begins to feel better immediately after eating or drinking something, give him a diet that releases carbohydrates slowly, such as a sandwich, a piece of fruit, biscuits, and milk. Find medicines. Help the patient find medicines. Check his glucose level if he has a machine at home and give insulin when needed. Stay with the patient until his condition recovers. Keep in mind that if the condition starts to get worse, skip everything and consult a doctor. Symptoms of high blood sugar. The prevalence of blood sugar is often a problem for diabetics, and it can happen within days or weeks, with symptoms such as these. Weight loss, itching on the skin, too much thirst, get a lot of urine, especially at night, heel wounds that take longer than usual, lying to the patient at all times, which can lead to anesthesia, can be an emergency. Quick actions: monitoring of the patient. If the patient is breathing properly, hang him on the side. In this position his respiratory tract will open while the vomiting will go out. If he is unable to lie down on the side, check his senses, breath and heartbeat. Check the patient again. Keep checking the patient frequently until medical help arrives. Call for emergency assistance. If the patient falls and you suspect blood sugar increase, check his or her breath and call for emergency medical help.